to review kind of the basic functions of refer with searching and recording. And hopefully you take away 2 or 3 things that you just either forgotten or maybe never knew. Most people in the last 3 sessions said there were at least 1 or 2 things where they're like, oh, that was just really helpful. I always forget that you could do that in refer, or I didn't know that refer did that, or that was, that easy to do. So to just get this show on the road here. So you're using refer, and this is the July 2017 refer training. Hooray. So one of the things that I noticed was a huge difference in terms of how to frame this refer training versus the last one that I did, 4 years ago, is that we've been talking so much more about like that assessment and having that conversation before the search, that every interaction really begins really with a conversation to understand the client situation. And as the slide says, as I'm just reading it, identify their needs. The problem is refer isn't really structured really well to encourage that. Right, like you get your call coming in through InContact or your chat, and you have to pick an access site. If it's a call, you're looking at InContact to see where it's telling you it's coming from. You pick that access site, and then refer is just pushing you right into this search screen where it's kind of telling you, oh, just get that zip, just get that age. Let's search, let's find stuff. Let's just get resources as fast as we can. It doesn't really encourage kind of that structure that we've been sort of pushing over the last 3 years. And so, I don't know, it's interesting to me that the tool that we have you constantly kind of using and referring to is sort of at odds with that greater methodology. What I've been kind of saying in a few meetings and trainings is that I feel like it should be like you jump in, you got to select your access site currently. Unfortunately, I wish, we could at least even get refer and InContact kind of talking to each other a little bit better, but or at all. But you select your access site, and then you just get to a chill out screen where you get to just say, tell me a little more about that. What's going on? What have you tried in the past? Something that isn't just really trying to push you right to that search, right? Because it's in our little baby hedgehog and our little baby duck here that is really your first opportunity to understand the client's request and identify potential needs. It's that moment kind of before jumping into that search where you really get some time to breathe, start to build that rapport and figure out kind of what someone's needs are before just grabbing, refer kind of wants you, it almost looks like, to take the first thing that you hear and just jump in and search on it. And so just in listening to some calls and talking to some people, I just wanted to start this off by just more of a reflection on that request versus need. I had a conversation with a specialist the other day who got a call where someone was just asking for the complaint number for JFS. And it was great. And he kind of stopped and said, okay, I can help you with that. I definitely want to help you. What's going on? What's happening that you want to complain to JFS? And they said, oh, I didn't receive my SNAP money this month, my food SNAP money, which is what the presentation says. But and so able to have more of a conversation also around food stability and other food resources while we kind of worked through and explain the process for working with JFS. Situation where someone asks for a photo ID. And, we have, of course, those programs to kind of help pay for that. But, what's going on? Oh, they're trying to get financial aid to pay for school. They need an ID for that. We can also talk a little bit about FAFSA and some other things. Someone calling and asking for help with an electric bill. And again, taking that sort of relaxed hedgehog moment to sort of say, oh, what's going on? I'm really sorry to hear about that. What's happening? Oh, electric got shut off for non-payment after a fall on the job that made working impossible. Workers' comp hasn't come through yet. Just opening up just more of those. Tell me a little more about that possibilities. I was really, when I went to put this together, I really thought I was like dead set on like a baby pig. And for some reason, it wasn't that the baby pig pictures weren't cute. None of them were like reading as community service navigation for me. I don't know why. There was even a really cool one where the baby pig had galoshes. So I would look for that one. But I don't know why. The hedgehog, which really spoke to me. Anyway, so you've done that assessment. You've talked to your caller. Now we're on our search screen. We're ready to look for resources. And then we kind of get to that first thing that, I mean, my gosh, how many times a day are you thrown into that screen where you get to that first page and that first fields, the zip code and age of person in need. And the why here is the first thing I really want to review, because just being on site and listening to calls, I hear a lot of different versions of context around those questions. And we do have the one version that's in the script, as sort of a suggestion, as like, here's something that is completely accurate as to why we're doing this that you could use. I know on a couple of webinars yesterday, I heard from people, Tom Minchell had a different version that was a little bit longer, that just explained a little more about I'll just jump to it here. Because programs serve different areas and ages. And I think Tom kind of personalized his a little bit more around, wanting to find programs that serve that person's area of residence and their age. I think Cam on this morning's call went on even a little bit. Hers is a little bit even more expanded. But I guess the first thing I would ask is, like, people are comfortable with the fact that the reason we're doing this is because it's narrowing your search results to just services that serve the zip code and the age of person in need, the person in need. It's not because you have to do it to search the database. Like, I can search refer without putting in that zip and that age. It's not really to locate resources close to them. I mean, it does kind of default to arranging it by proximity, but you can sort those options to arrange it however you wanted. List them in alphabetical order, list them in zip order. It really is that we want to link someone to programs that actually will serve them based on their residency and their age first, and then all those other great assessment questions that you have sort of already asked to identify the need, but then certainly that you're going to be asking more pointedly around eligibility for specific services are going to come after. But I've been asking, like, does everyone feel comfortable with being able to set up and explain that zip code search? Or does anyone have, again, like I asked the other groups, any particular way that they like explaining that it's, to filter for that eligibility? Anybody? No? Okay. I mean, that's cool. And again, you can just use the scripted one is fine too. But you also just want to be clear, you don't have to use the scripted one, but if you're not going to, it is just really important that every time we're setting that up, we're at least capturing that reasoning. While we're on the topic, just in general, providing clients with context around any assessment questions, I find this really, really helps just in building rapport. The example that I've been using is even, you guys know all the programs so well, and we get certain requests so frequently. I think it's easy to kind of take for granted what a client may or may not already know once you're interacting with them. And so the example I always think about is rent payment assistance. And like, that for PRC, for example, you're going to ask them, do you have any minor children in the household? But sometimes we don't even get to the point of explaining. We don't get to that moment of being able to explain, like, okay, I definitely want to help you search for programs now. Some of these programs have different requirements. One of the major ones for major program is, do you have any minor children in the house? They say, I need help with rent. And it's like, oh, you need help with rent. Would you have any minor children in your house? And apropos of no setup, it seems like a really strange question, even though we know it makes total sense and you have to ask it to figure out if they're eligible for PRC. But I think it's just setting up some context even around, and again, it's something that Refer doesn't really, isn't poised to really suggest to you or push you in the direction of any of that setup. It's just, you're just getting these still pieces of information, even in terms of like the vet line question and stuff is another one. That vet question, the vet question is interesting though, because I would assume, you guys are, even when we're not recording it, you're asking it in most basic needs situations in every county because of the VSC. So maybe the better example is in Cuyahoga, like that, do you need help with the cost of prescription medication? Which of course we're asking because, hey, we have this MedRefer program that can help link people to affordable medication. Do you need help with the cost of prescription medication? Rather than something like, oh, we really like to ask people if they need help with the cost of prescription medication or something like that. I mean, I enjoy it, but I think sometimes just some of that context is cool and helpful. Really, just both in terms of building rapport and kind of educating clients about different requirements and sort of how the social services infrastructure works. Mr. Trahan's going to step in here a few times to remind us of some stuff. First of all, just be super duper careful about changing zip code and age to match the person in need of service. Again, I'm sure for all of you, this is just an unnecessary reminder, but I just want to go over it. A lot of the content here is just based on different conversations we've had with folks in the last couple of months based on questions they've had about to clarify how refer searches and things. And so this is just that point that if you're talking to someone and you're finding them resources like you're looking for like diapers for a 2-year-old and you're talking to this 2-year-old's grandmother, and then the grandmother says, oh, also I need some help with transportation. You definitely want to make sure to change the zip and the age. If she lives, of course, in a different zip code, or she lives in the same zip code, you don't need to change it. But changing the age and, if necessary, the zip code. So when you search for transportation, I would think in many cases, services for 2-year-olds and 65-year-olds that could very much change or limit your search results because they're just, different programs serve different areas and ages. I was going to trail off, but then I was like, oh, I can default to our phrase. This next bit, I'm just kind of going to go through some of the functionality of Refer, especially some stuff that, again, mainly questions that we've gotten in the last 2 months just about searching and some other features. But before I do that, does anyone have any questions about some of that initial stuff? Any feedback? Any suggestions like you want to give to other staff members? Or questions for other folks? These 6 o'clock people are all just like me at 6 o'clock right now, and I'm a 6 o'clock person, and we're all just sort of tired and moving through with it. But that's cool. I know if you do have a question, you'll speak up, and it'll be awesome. 3 ways to search Refer. You know this. The first way, by taxonomy term. So I'll just highlight like a few things. Let me make sure I put some demographics in here about both to create a more relatable facsimile, but also so we're not waiting 2 million years for 4,000 results to populate every time. So of course, searching by taxonomy, what we always stress is less is more, especially if you're not sure the name of a term or something. You can do a partial word, it defaults to that, and then just get tons and tons and tons of resources that, yes, you will have to scroll through these. So if you can find a way, I guess the more exacting you are about what partial word you put in, the better. And certainly if you know a term, there's no reason not to use it. But sometimes if you're not sure of what term to use, that can be helpful. One of the other things I've been highlighting is that you can pull up definitions of any taxonomy term just from here. And I know everyone kind of has a different style of conversation and different style of navigating. So I don't know how many people are using this or not using this. It's helped me a few times when I've had callers on the supervisor line when we've been trying to figure out kind of what the caller is looking for, where there's been an issue identifying like a type of service around a need. I'm bringing it up around substance use disorder stuff in general, because I think that stuff in the database is so confusing right now in terms of the difference between some of the different services. And so that service term definition can help, I think. And, if you're saying to someone, oh, are you looking for substance use disorder counseling? They're like, I don't know what that means. And you can kind of pull this up even before pulling up, searching on it to say, oh, well, it's a program, that might provide individual, group, or family, et cetera, et cetera. And when they can, you can either get buy-in from that caller, like, oh, that sounds great, I think that would help, or no, that's not really what I'm looking for, or yeah, no, I know, that is what I'm looking for. Go search for me, or whatever that interaction is like. But I think it can be helpful. With these, just so you kind of understand what you're looking at when you pull up these definitions, you have a See Also term. This is other taxonomy terms that when the taxonomy was created, somebody thought, oh, well, if this isn't quite what you're looking for, but is similar, here are two that maybe you could also look at if this isn't quite right, but is sort of close to being right. And then the use terms here, this actually is just showing you the different combinations of words you could search, where if you searched these, it would say, hey, use substance use disorder counseling. So like if I were to search, addiction therapy, it should tell me, hey, use that substance use disorder counseling. So that is that definition feature, which is cool. If I'm trying to find something, and this happens to me more than I would probably like to admit, and I entered what I think is the correct word or term, and I keep getting no results, no results, no results, and I'm getting really frustrated, I can remember, oh wait, there's a spell check. Maybe I just committed some horrible spelling error. And so this exists. What's really cool is like every couple of years, when we do this training, this is the thing. I've had more people afterwards like come up to me to be like, I didn't know there was a spell check, or I forgot there was a spell check, more than anything else. And it's something that I think even in my little slideshow here, which is more to remind me about what's going on, it's not actually that helpful as a training tool. But, that less is more, definitions can be helpful. And there's a spell check button that I always forget about. Okay, the next bit, but again, I'm sure will look very familiar to you, is searching by name. And you can search, of course, by agency or program name, and then address, city, zip. I know frequently, probably when you use this a lot of the time, and again, I'm sort of making this up, but sort of also inferring it from interactions I've watched. People will ask about like an agency or a site at a specific address, and then you're kind of plugging in that address to see what is there, I would think. For this example, I'm just going to use the name. So I'm going to do Salvation Army and search. And it's warning me that there's a bunch of results, but it won't take nearly as long or be nearly as aggravating as it was earlier this morning's presentation, where I had not populated this information first like a fool. Well, it's still taking a little while. There we go. You're familiar with this. One of the things I don't like about this search, and you guys probably noticed it, but like if you are looking for something like the very specific name of a program like Camp Neosa, even if you know, oh, Neosa, like I'm putting that in, a caller's asking about it, I can't seem to find it under camp terms for whatever reason, you're still just getting this huge list of everything at Salvation Army. So you still kind of just pick through it. It's telling you, hey, I found an agency that has a program with that name, but here's all its programs, and try to find that name somewhere in there. I'm not 100% sure why it searches that way, but I think it's weird. But regardless, let's look at something here. So you guys are probably familiar with, so like someone's asked about a program, you pull it up using a name search because for whatever reason you can't locate it using a taxonomy search. So you found it, but there's no phone number or anything here because it doesn't know, it knows what service you want, but any service could have multiple taxonomy terms linked to it. I think in this case, probably it will just have the electric service payment assistance, but you could have multiple things here, and I'm not sure, maybe disaster assistance will be a better example. So yeah, here's like one with two. And so each of these could, theoretically have a different, extension maybe. The point is everything in refer is entered at this service site level, where it's not just entered a program at a site, it's a specific service within that program at that site. So if you pull something up by name to record it and give the correct phone number and everything to get to all that juicy match list information, you're also going to have to pick the service term that you want that directly applies. The other thing with the name search that I know we always stress, so you're probably tired of hearing it, but I'll repeat it anyway, is if you're looking for something for someone, like based on a name search because they say, hey, I want this program, or I want the number for this program at this site because they help my friend or whatever, let's say it's electric service payment assistance. Once you've given them that information and, screen them for it, make sure they qualify and made that referral, I think it's really important to at least offer, and I know they won't always take you up on it, but at least offer to say, hey, can I search for that same type of service for, say, electric service payment assistance, just sort of in general? Because there may be a program that's closer to you. There may be a program that fits your situation better. A lot of times when people are asking about a program specifically, it's because they heard about it from someone, it helped a friend, it helped a family member, but there may be another more suitable program for their situation that they just don't know about. So they don't know to ask for it. But we should offer to search for it. And then sometimes it's cool to be able to run that search and find a bunch more options that, again, might even be closer to where they are, even if it's a very similar program. So that's cool. So that's your name search. And look, I hit both my points there. It was way more impressive when I was hitting all those like yesterday at the 9 a.m. training. Now I've been through it like 3 times, so it's kind of like if I miss one, I seem pretty lame. And then by category. The category search, there's not really too much that I think is tricky about the tool once you're trained in it, of course, which you all are. I mean, I know this used to be like the main thing on our public-facing website, and people found it ridiculously difficult to navigate because it's daunting. Just because of the number of services there. But I just want to make sure, because I know not everybody uses the category system either ever or only uses it occasionally. So I just want to kind of go through a couple of, especially the very specific categories that we've built over time, just so people know what they can find there. You do have still a lot of the old general categories that we had, where it's like a list like donations and volunteering, and then a list of subcategories, then under the subcategories, some much more specific actual taxonomy terms that you can use to search. More recently, we've kind of been building these specialized categories that are usually for some kind of special project or very topic specific, where either it's something like tax season where we get a ton of calls and it's really like there's just a lot of different issues around it, or I'll show you guys, remind you guys rather about the utilities one, where that was something where we had a utilities category, but it was just kind of this broad utilities thing with a list of tons of utility programs, but there's so many nuances, as you all know, to like utility assistance, that it just wasn't very helpful to even try to parse out or navigate. But the first thing I really want to highlight is this 2-on-1 special projects, because a couple of these, especially the fatherhood line and help to veterans, have these kind of odd terms that you don't see attached to any other programs in the database. And that is intentional, because we wanted to make sure that when you are doing that tier 2 escalation for either of those programs, to make it as easy as possible, essentially, to find the program information so you can tell the person about it and make the referral. You may have noticed in the last few months, when opening this up to kind of talk to somebody about help to vets, when someone says yes to that vet question, you want to let them know, hey, did you know we have a help to vets program? Matt Trahan, the resource department, and Tim worked together to really better define the service description. I didn't like that description at all before. I felt like it was really, really general, and I didn't think it really explained to someone why he might be transferring somebody. And so we all talked about it and agreed, like, oh, this thing we wrote, years ago when this first got started, before we really understood everything Tim was going to be doing, should definitely be updated. So hopefully that has helped in explaining to people, what the Help to Vets program is. Same thing now, especially that we're asking that prescription medication question. We've kind of reviewed this service description around some of those healthcare needs, and especially the second bit that really talks about what MedRefer does. And so this is a really easy way, even though we do have other prescription medication services in the database, we have this set to a priority. Again, just to make it easier to pull up, since we are encouraging you to tell people about it, and if appropriate, if they do have those medications they need help paying for, to escalate that call over to Adrian. Just want to make it easy for you guys to be able to find this and record that referral. And also, of course, explain to people, why are we asking this prescription medication question? Otherwise, yeah, it seems a really weird question to ask on like a food pantry call. So you got those special programs, also the fatherhood line. Next, emergency shelter stuff. So we did set up those two emergency shelter categories. We kept them separate just because some of the terms were really different, and they're just very different coordinated intake systems. But these are the two that we really have the most sort of stake in Lucas County, of course, because we are the coordinated access, and then here in Cuyahoga, just because that coordinated access program is so specific in terms of its hours and its intake methods, that after hours especially, you know, I know everyone's talking to people and trying to work them through that process. So we tried to do the best we could to set up some of the stuff you might need to help better find things and separate stuff for the holidays, weekends versus the after hours and coordinated intake and all of that stuff. So you got those. Access problem gambling. This is probably the one on earlier sessions where the most people said, oh, yeah, I use that one all the time. This one is pretty straightforward. It's got all the stuff you would probably need to set up and work through the different kind of resources available to someone on that problem gambling line. I added, I noticed, I think someone pointed out that the gambling regulation term, which we do make referrals to sometimes when people, you know, either want to make a complaint or are just interested in what sort of, you know, they're questioning a casino's practices or something, that this wasn't linked to this category before. We had it indexed and we had made referrals, but I wanted to make sure this got linked to this category. So that gambling regulation appears there now. So that's good. Someone else said they really liked the affordable health care. Well, it was created for affordable health care, Obamacare. It also has a lot just about Medicaid, because it went into the Medicaid expansion. And some of this information, which may be changing drastically shortly, we shall see. And then the last one I really wanted to just make sure everyone was aware of is the utility assistance one, which is just super new. We only created it this fall, and Rob helped build this one around his training on the utility programs. And again, we used to just have, I think, just a huge, maybe we had two subcategories for utilities, but they were just kind of these giant lists of services. And now we just have them split up into like that cash assistance, the discounts and payment plans, getting help avoiding disconnection for the places that have negotiation assistance, your negotiation assistance stuff, and your local and state utility information and complaints. So I think that stuff is helpful. Let me see. Yeah. Hey, I did. And I got them all again. Go me. The other thing I've been going over are the filters. I mean, I know you guys know that there are filters. A couple things that I just wanted to mention about them, and also to look at a couple that, again, we had a few people say, oh, I didn't know you could filter for that. But service days, you're using these all the time for food pantries and hot meals. We do get questions about how the filters are applied sometimes. The way that it works is the resource department tries to apply any filter that could possibly apply to a food pantry or hot meal, which means that if there's something that serves the last Monday of the month, we're also going to apply the 4th and 5th Monday filter, because either the 4th or 5th could be the last. So this is why the intention here is to narrow your search list, but it's never going to make it exact. You're never going to know without opening a given pantry if it, you know, because if it is a case where it's the 4th Monday and the pantry only serves the last, but there's a 5th Monday in that month, of course, it's not going to be open that Monday. But like I said, it's going to have the 4th, 5th, and last filters all added to it, just to make sure that if someone leaves out a filter in their search or doesn't, it is the last, but someone searches 4th rather than last, they're still finding it at least on their match list now. We don't want to exclude any resources by mistake based on what a specialist is searching. But that just does mean it bears a little more attention with the hours of service. The other thing to point out is the by appointment. which I have forgotten about on several occasions when searching for stuff. And someone else on the last call said, yeah, this is really important in the regions to remember that in addition to kind of some of these walk-in, the sites where you can basically walk in at these given times, we have these other by appointment ones that if you're talking to someone on a Monday and you can't find them anything, you may also want to search a Tuesday by appointment and a Wednesday by appointment in addition to some of the other Tuesday and Wednesday ones to see if maybe they can get set up with an appointment at one of those appointment only. It's early enough in the day, Monday, throw Monday by appointment too, in case the place takes same day appointments. But wanted to make sure everyone was aware of that. We have, of course, our tax prep filters, which, we've gone over those enough with tax training, so I'm not even going to talk about those. Donations, this pickup may be available. So, when someone wants to know if there's they have something they want to donate, they cannot drop it off somewhere, you can filter your donation terms for especially things like furniture donations where pickup might be available. These are old and should come out, especially this vouchers waivers was from ADRN, so that's not even relevant anymore. I should remove that. Languages, you guys are using those. Someone actually, this came up the other day again, it's not necessarily, I think like all this refer stuff, I was like, oh, it's so crazy that this stuff was coming around, all coming up right around when I was preparing this, but it probably more has to do with like for the last 2 weeks, I've known I was doing this. So when these questions came up, I was actually like taking note that, oh, that would be a good thing to mention on the training. Which means that if you ask me a question about refer more than 2 weeks ago, it probably won't be addressed here because I wasn't thinking about this then, but hopefully I answered it then. But the wraparound schools, we had someone calling asking if their child's school was one of the wraparound schools because they didn't know. And someone had asked, like, is there any way for us to pull up which schools are wraparounds? And there is. It's with that wraparound filter, which is attached to all those grades. Terms that are, the individual terms for pulling up the different schools. So if I apply, I just picked intermediate schools sort of randomly. But if I apply that CMSD investment wraparound schools, I now just have a list of the schools that have wraparound services for whatever it's worth. If you get that question, there is a way to do it. And then, someone asked about this too. Yeah, the shelters and transitional housing. For Cuyahoga and Lucas County, you can actually filter for ones that are a coordinated intake / access shelter versus a shelter that does their own intake, one of the private shelters, if you're using just the homeless shelters term. The other thing I wanted to make mention of with the service days that I forgot to tell you guys, 2 weeks ago, we did a calibration call. We were doing calibration, and it was a call that involved a referral to Hot Meal. And the specialist was really having trouble because this person said they wanted a dinner that they could go to after they got off work, and realized this, you guys have to open now, even with the filter, you still have to open a lot of those hot meals to see like, but what time do they serve? Which that's really lame. So what we're going to do in the next week or so is make sure that all the names of your service groups for hot meals say, if it's a morning, afternoon, evening, breakfast, lunch, dinner meal. So that way, hopefully, when you have that, once you do your filter, it'll make it easier to kind of scroll through and see which type of meal without having to click on every single one, which it seems like sort of an obvious thing to do. So sorry that hadn't been done before.
Matt?
Yeah.
I have one other question with the wraparound schools.
Oh, sure.
Because I know some of the wraparound schools qualified, people who are looking for rental assistance can qualify under the Cleveland Housing Network.
Yeah, through the Family Stability Initiative. Yep.
Yeah. Is there a reason when you're looking for rental assistance, it doesn't come up when you do a taxonomy? You have to actually.
There is. That's a United Way funded program, and we were kind of told, no, we don't want to call this. It is not. We do not want to call this rent payment assistance.
Okay.
And then they had complained that they weren't getting enough referrals, and we kind of said, you'd get a lot more referrals if this were called rent payment assistance. And they said, no, that's okay. We would not like you to do that.
Okay.
So it's kind of a unique situation. But it was good in a way because it's why we broke out all that landlord-tenant stuff into those more specific terms about tenant rights, landlord-tenant mediation, eviction prevention. And I mean, there are eviction prevention programs that are not rent assistance programs. So, I mean, I think having that eviction prevention term ultimately is a good thing for the database as a whole. But that is why in that case where I can see, I mean, you could go either way because it's not necessarily they're only going to pay the rent in a worst case scenario. They're going to do everything they can in terms of mediation and all that before to keep you from being evicted before paying the rent. So I understand their perspective that it's not rent payment, but like ultimately it very well could be. So it's kind of that back and forth with your energy audit.
Yeah, I always have to kind of look it up by name.
Right. Where like the energy audit's not like a refrigerator program. So we were getting a lot of pushback when we had it under appliances years ago, but most people think of it as an appliance program because there is a good chance you will get a refrigerator from it, but it is really an energy audit program. It's kind of one of those. That's another CHN one. But yeah, so I mean, that is the reason. But as I said, there are other eviction prevention assistance programs that are also definitely not rent payment that we can now have been able to kind of earmark a little more specifically. So that, it's a good, just kind of got to remember that there's, that eviction prevention versus just, strict rent payment. But good question. So that's it really for the filters. The other thing is, of course, you guys know there is a 211 search function. So that 211 search, again, more just as background, that links you to AIRS's 211 database. It links to a database that we do not maintain. And especially in the last year, there's been a lot of turnover in the state with 211s. And although I think AIRS is pretty diligent in updating this database, the problem is it's a static. I think it kind of sits and gets updated. Like Refer has to actively import the update. So even if, AIRS updates it 3 times in a month, Refer may only update it at the end of that month. And so for that whole time, you have some stuff that's inaccurate. And there's been a lot of stuff that's sort of been hanging out, not being updated with some counties. So we've been working with the two to make sure that 211 search gets updated. And then, of course, also if you are working within Ohio, we have all of the comprehensive information referral providers that are not 211s in our database. So you just do your comprehensive information referral search if an Ohio county does not have a 211, and we should have something. I mean, again, these are just agencies that in our calling around to counties, I know in some cases it's community action, in some cases it's job and family services, have sort of stepped up and said, we would like to field those calls. And then there are non-211 accredited information referral providers that can be located either if they're in Ohio through that same search, if not this same search anywhere in the country, gives you that AIRS search where you can just look for not necessarily 211s, but those INR agency search, which actually there's 211 and non-211 through the AIRS website. So there's those options, but mainly I just wanted to make sure to give some more context around that 211 search and why that is not. It's because there's really 2 entities involved in updating that one, and we are not one of them. Oh, the sort options. I'm so glad I put this slide in with Mr. Matt Trahan looking all mad at me, because I forgot this on the last 2 things, and it's something I've gotten so many questions about. Well, not so many, but just something we've noticed. So let me actually change this over to food pantries, because this is an example that makes more sense. So if you're looking for a food pantry, let's say you're looking for food pantries for someone in 44115, and let's also assume that I've added their address since we're in Cuyahoga County, so I'm not getting a million hunger network entries coming up. But and then you talk to them a bit, and they say, yeah, but I spend a lot of time in 44105 because I work there. It'd be easier for me to access a pantry in 44105, even though I'm living, over here in this apartment in 44115. just want to make sure that, like, I just feel like it's a lot easier because if you change the zip here then to 44105, you're going to get this huge list of pantries that you now have to sort through to see, like, open individually to see, well, does that also serve 44115? So just so people know that I think an easier way is to sort them either by zip or by city. So that way you're sorting the same list of pantries that serve 44115, but you can kind of reorganize them and say, oh, but they actually want to go to a different 44 zip. So now it's those are my 43s. So here's like, oh, maybe they want to go to, well, that's a Hunger Network. That's a terrible example because I can once again assume I put in the address. They want to go to 44103. And so this church also serves 44115 rather than putting in 44105 and then having to go through them and say, well, which one also serves 44115? Just an easier solution and a cleaner result set. Okay, so this is another kind of switching point away from searching and more into recording. So before I do that, are there any questions like up to this point? You guys feeling good?
Oh, I got one question.
Oh. Cool. What's up?
So go back because I was a little short coming in on the spell check button.
Oh, spell check button. Sure.
Yep. Just point to where it's at.
That's the ABC.
Okay, got it.
Right right next to the clear. Yeah.
And that's only for when you're doing going in taxonomy, right?
Yep. I believe it is only substance. Yeah, and then you get your thing, and then you can just say change if the suggestion is right. Yes, that is only, it wouldn't be for category. Yeah, it's just for the taxonomy. There isn't one on the name search. Cool. Okay. So now we're into kind of recording stuff in Refer. Again, like you guys know, there's referral and non-referral actions. The slideshow gets, I was not as judicious in my editing, although crazy to note based on kind of what I was saying about how different our approach was 4 years ago when I had originally done this. This used to be the first slide of this presentation, which I think is telling and kind of unfortunate. So sorry about that. But so there's 4 different refer actions, referrals. I'm just going to go over referrals really quickly because it's something that I think everyone's super familiar with, as it is hopefully most of what you're doing, at least when you're able to find resources. It's at least most of what you want to be doing when you're working with a client. I think it's finding resources that serve their needs. So just so everyone's on the same page that a service referral occurs, really once you've assessed their eligibility, of course, reviewed the service description with them. And I mean, the big 2 pieces here are that you've got buy-in from the client that like, yes, that service sounds like, that program sounds like it would help me. And that yes, they understand how to access it. You've gone through the required documents, any fees, the intake process, and they said, oh yeah. And then said, oh, does that all make sense? Do you have any questions? And they said, no, that's good. I understand how to access this. And then, you and your client are both on the same page. And then you can pull up your resource and record that referral. Straightforward. The only other thing I wanted to go over with your referrals really has less to do with saving the referral itself and more about like your email and text options. So, there's 2 different ways that you can send emails and texts. One of them is at the individual resource level. So, you could send just the information on this Second Ebenezer Missionary Baptist as either email or a text. You can also, if someone wants resources emailed to them, of course, at the end of the call, once you've made your referrals, go into, do that again, and move this thing out of the way. No, I want to move that. Okay. Your contact activity here between your letters, mailing, and support system, where you can kind of review all the different resources on a call. You can also send all of that, all of the referrals, and sending an email, you're doing the same thing. You're just sending one single email. So you have this whole, when you send the email, it is all of this information for every referral you've made if you send it from there.
I got a question.
Yeah.
If you send it from the contact app activity, say you've given them like maybe 2 or 3 different contacts, is it going to send all 3, or do you just have to send them still one each at a time?
No, it's going to send, if you do it from the contact activity, like here, it's going to send both of these.
Okay. All right. And one text as well.
Well, I mean, it might break up the text. With text, it's this might be an easier way to send. I mean, it's going to break it up based on character limits. So either way, you're probably going to send multiple texts. But you don't have to, enter the number a bunch of times. This way, you can enter the number one time and have it send all of them in the same number of texts, essentially, that it would have been to send them each individually.
But the email, it's easier than just doing one email at a time and one email at a time. The other way.
Yeah, I mean, I think it's easier in both cases, because especially with the text, that way you're not picking, like, this way I'd have to, do this whole thing for each resource, whereas if I do it from here, I'm only doing it one time, and it's sending all of them. Just saying, their phone's still going to break it up based on character limits. So in terms of how it presents to them, it's probably going to be similar to sending them one at a time, but in terms of the effort you're putting forward, it's definitely going to be easier to do it this way. And then, as I said, when you send an email, people are getting all of this information, that whole service profile. When you send a text, they're going to get the name of the agency, they're going to get the address, and they're going to get the match list phone number. So the phone number associated with the service that you made the referral to. And so, yeah. My last note in here about, I've barely been using this PowerPoint at this point. It's interesting because I'm just so comfortable with the content at this point. But any emailed or texted referrals, we're down to the last bullet. Anytime you're emailing and texting stuff, and I think we see more frequently with people taking, if you take chats, I think sometimes it's easier to kind of default to, because the interaction takes so much longer. And sometimes, especially maybe even with hot meals, it's almost easier to kind of, if you understand the person's situation and you have their zip code and everything, to just make referrals for a bunch of stuff on your match list and send it. Again, generally, you really want to make sure anything you're emailing people or texting people is something you've discussed, especially the eligibility and required documents, before just sending someone 6 or 7 referrals just off the match list, because they say, hey, can you just send me a bunch of these things? You go, okay, click, 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 send. Again, I say generally because I know there are going to be situations where you really can't get around it, and other situations like the hot meals where it's not that huge of a deal to do it. But I would do the best we can to have the process seem to not be automated. I'm sensitive to this right now because part of the Accountable Health Communities grant that we got, the way the Center for Medicaid and Medicare Solutions has imagined that you can do social service navigation work is what they essentially want is a system where we would identify that someone has a food need, and then we stop there. We just know from a screening question, oh, this person needs food. And then we type in their zip code and just send them a list of anything in refer that serves their zip code that has to do with food. And part of the reason we got the grant is that we pushed back around that and said, that doesn't really work. That's not really helpful. We can do it. It's not hard to automate that process and even have someone put their zip code in, in the phone, and just select food and just get emailed a whole bunch of stuff. But you guys know, you kind of got to talk to them and see not just what type of food need they have, but what other needs are going on. So as an extension of that, I'm just kind of keep going on about it recently. Unmet needs. Had a lot of good questions about these in some of the earlier sessions. And I still, despite the fact that I've complained about this definition in this PowerPoint, I think at every presentation I have not changed it because I just don't think it's quite accurate. But so, a need is unmet when the taxonomy term associated with the need the caller has requested or agreed to either fails to return a result, So that's true, but or returns one or more results the caller either refuses or for which they don't qualify. Where they refuse or don't qualify for all results is the piece that's kind of missing from there. Because of course they could return one or more results. I mean, I guess they'd have to not qualify essentially for any of the results that are returned, or refuse them to be an unmet need. Oh, I don't need refer yet. I forgot that I actually have like some examples in the PowerPoint here. So this is like a super simple example, but you're going to be like, why are you telling me this? Obviously I understand that. But I'm looking for a food pantry. You say, oh, sure, here's some. And they say, no, those are all too far away. I don't want any of that. And then you kind of say, oh, okay, but maybe I could find a hot meal or something that would be closer where you could at least get some food right now. And then when you talk about food stamps, he goes, no, never mind. I'm good. And there's your unmet need for food pantries. The only reason I kind of have that included is that I just remember last time we kind of did some training on this. There were just some questions around, you have your food pantry unmet need there, obviously, but you've suggested a soup kitchen. The person has said, no, I don't want that. That is not an unmet need for a soup kitchen because, again, just in terms of how that need's identified, it's mutually identified by yourself and the caller. So it's really the only reason I provide that. Recording-wise and refer, I think this is a better example. In terms of, because what I'll show you is we'll look at the scenario and then I'll show you how actually your transaction would look after this situation. And this is kind of the situation I use when I'm talking to even tours coming through and they're asking about like really what is an unmet need. And what does that tell you about an area or the needs in that area or a situation? So a caller needs their roof repaired. For this example, I just lazily used 44115 of our United Way zip code when I was doing this, just so you have a background. They have a problem with their roof. They need to get their roof replaced. They're looking for someone to come and repair the roof. So the first thing you check is home rehabilitation services, because you want to, of course, find a service where they're going to send someone out to actually perform the repairs. But that doesn't return any results that offer roof repair. There's like there's some furnace repair stuff. There's some other repair programs, but none of them will do roof repair. Okay, so you talk a little bit more to your client to see if maybe they would be interested, even if the agency is going to send a person out. Maybe we can find a way to pay for the roof repair, even if they have to kind of locate a contractor or get some price quotes. Okay, that they're amenable to that. So you search first home rehabilitation service grants, because this way they don't have to pay the money back. And again, doesn't return anything, or also doesn't returns anything is what I have so literally crafted. But so that does not return anything once again. So finally, we're looking for home rehabilitation loans. The client said, okay, well, if I have to pay it back, this is the only way to get this done, what are the options like? And then this search does yield some results. You're able to make the referral. But the transaction then is going to look something like this, where I want to make sure, I've captured that the best service to meet their need was a home rehabilitation service. And we could not get that. It was insufficient to meet the need because none of the services we have helped with roofs. Same with the grants. And so I do have finally my referral. But this way, I mean, if you think about it from, someone looking at this to understand needs in the community, this kind of tells that whole story of all the work that you did and the conversation that you had, everything you kind of searched for them in that path through solving that problem. Because if we just have that home rehab loans referral recorded, it doesn't alert anyone to the fact that there are these unmet needs for the grants and the services. It just looks like people calling us just love asking for home rehabilitation loans, and we're giving them out like hotcakes, and they're just loving it. So I think that is a better example than maybe that food pantry one, just in terms of understanding both the importance of the capturing unmet needs and how even just through one situation, you may talk through a couple different needs that are unmet before you find a solution where even though you have found a solution and it's kind of one, to the caller, it's one need, it's getting that roof fixed. But there are a couple different resolutions that that would have been more appropriate than the referral we eventually gave. And I think it's important to capture that. And again, just from your perspective, to kind of demonstrate the conversation you had, and so we can really see reflected, like, you tried everything you could first before getting them to that loan. you guys know how to record unmet needs, but I just again have been giving a little context around some of this stuff because I feel like it's not. I mean, even if it's covered in training, when the first time you train, when you come on board, it's not always. It doesn't always relevant. It doesn't feel relevant because you haven't actually had to do it, with callers. But even when we do these refreshers, when I was looking at the one from 2 years ago, there were some major things that I'm trying to cover here that were just left out of that training altogether. Just
I got a question.
Yeah.
Because this comes up a lot for me with job finding assistance programs.
Yeah.
And should I be recording it all like that unmet need? Because sometimes a personal, it'll be, unmet need based on their age, or it'll be an unmet need based on that I already tried this place, I already tried this place. Like I had one guy, every place I gave him, he already been there. And he must have, because he could tell me exactly what the taxonomy was.
Right, right.
So should that be put down each time if someone says, well, I've been to such and such and such, consider it an unmet need? Or if it is one, just record the one and don't record the other three?
Oh, so great question. And yeah, that's actually where I was just about to. So no, you are anticipating what I'm covering. Because yeah, my next point is that one of the frustrating things about refers, you cannot select multiple reasons, even though I think to your point, someone may have multiple different reasons that they couldn't meet the need, that the need's unmet. I mean, if they couldn't get to 4 things because it was all they were too, like unmet needs should always be recorded, I mean, in terms of the need, not the individual resources, which is to say if you have 4 resources and so there's 4 job finding assistance resources, you can't link them to any of them, and the reason is because of age for all 4, then it's an unmet need. We couldn't find them job finding assistance because of an age issue. But if you have 4 different resources and one of them it's age, one of them they're lacking the necessary documentation, and then 2 of them they tried and they didn't like, and so it's a service complaint, or they're refusing a resource for not like a complaint, but whatever it's called, agency reputation service quality, then it would be 3. I mean, you say job finding, okay, the one reason was age, the one reason for the other one was I'm like belaboring this by trying to find the correct things, which is it's an imagined scenario. That, and then the last one is service quality. So I mean, service quality, it was 2 different ones, but the unmet need isn't recorded at the program level. It's just recorded at the need level. So you may be recording multiples if there are multiple reasons, but not if there's multiple programs. Does that make sense?
Yeah. I just wanted to know because sometimes I'll go through that list and I'll just won't do it. I won't put it as an unmet need because I end up finding something that was a met need because it was so many different reasons.
Right. So I mean, if you do find a job finding assistance program for that person, you wouldn't record an unmet need, even if there were. So if you talk about 4 that they can't access, but there's one job finding assistance, they say, right, like, oh yeah, no, that one sounds good, I haven't tried that one, then that's just that referral.
Okay, so I don't have to say unmet needs for the other one.
Right. The unmet need you're recording at the level of the need itself, not at we are doing that project right now that I talked about the last staff meeting where and you guys don't have this option, but for each one, like Molly and Tim are saying, like if the person says for this one, oh, I tried that, I didn't like it, they're recording a reason for no referral to say, oh, well, this particular one, this person didn't like it, and now this particular one, reason for no referral, this was an age issue. But for you and everyone else right now, you're recording an unmet need to just talk about that job finding assistant need.
Okay.
So if you meet that need and make a referral, you don't record anything about the ones they didn't want. It's only if you can't find any job finding assistance and have to move on to a different solution
Okay, so
Um,
yeah, I've been doing it then the way you're saying it, but I was
yeah, yeah,
wondering,
yeah.
well, should I be just saying, because I have done it under the what you said, the housing rehabilitation. I
hmm
have, like, if
hmm
I go to rehabilitation housing for a vet and then there's nothing, I just say unmet need and go on to the next and the next.
Right, right, right. But yeah, you don't have to record it. Yeah, I mean, once you make a referral for a specific taxonomy term, there's not an unmet need. But yeah,
Okay.
if for home rehab services, you can't find anything, so now you're going to look for grants, rehab grants, which is a different type of service. Then you
Okay.
do the unmet need for the services and then start searching for the grants. You don't find the grants at all, so you do the unmet need for the grants. And then for the loans, I mean, let's say you talk to the person about 3 different home rehab loans. 2 of them they say, nope, not interested. 1 they are. That's just the 1 referral for the loan,
Okay.
and that's considered a met need.
Okay.
And then the other point so we just went over how you might need to record multiple reasons for a single unmet need, and it's really inconvenient now. That's my other main point with that, is just kind of how annoying that can be. I wish we're working with Refer to make this multiple selectable, because that would be way easier. And then the other point is that you don't need to include target populations when doing unmet needs. So like, for example, if you've gone through all these job finding assistance programs and the person refuses all of them, and then you do that assessment to see, well, maybe there's one that'll specifically target you, or and they're a vet, and so you do the search for veterans, and it's a different job finding program, but they also can't go to that one. It's assumed if there's not one for a target that there's not a general one for them, right? Because otherwise we could have also just sent them to the general one. So you can just record it at the general level. And even if you are finally, you've been through the general one, you've been through these, and you do record it at the targeted level, it's okay. It doesn't report out that way. It'll still just report out as an unmet need for job finding assistance. It just looks weird, like to just have an unmet need for job finding assistance for veterans, because you want to make, I always just want to wonder, like, oh, well, I hope the person just looked for general job finding assistance, because a veteran could certainly avail themselves of that. But I think usually it's because you're searching for that second or third after you've done the general one. But you don't need to worry about targets with unmet needs. Saving reasons. This is the last piece for this training that I've really been going over. Although if we have a little bit of time, I can also talk some to no data calls, but we're running pretty tight on time. So site and agency reasons were not even covered on the last Refer training that we did in 2015. I'm not sure how, but they were omitted. So I definitely want to cover this. So, we went over referrals and went over unmet needs, but there are going to be some calls where you don't have a referral and you don't have an unmet need. Even calls that aren't like a hang up. And I mean, obviously, this, you take them probably sometimes. I mean, of course you do. So that's why we have these site, agency, and reasons for contact. I mean, we really only want to use these because ideally we do have some kind of unmet need or referral. So again, you're only using these when you can't make a referral and can't record an unmet need, but those situations are not as infrequent as maybe they would seem. And so just so people know where these even are, especially these, because again, we didn't go over these in the last training. Your save reason, you got a bunch of these. And this is where, again, you can't really make a referral to the place, like an address request. The example I've been using with address request is like when you have someone saying, oh, I have a HEAP appointment at like CHN, the main office today, I don't remember where they're located. And you talk to the person, there's nothing else they need. They just need to get to that appointment. They already talked to us yesterday and got everything else. So you can record that with the agency as just an address request. So you're not making a referral, but you're also not just saving it as like problem or guidance and problem solving assistance or something where we have no idea what you talked about with this person. At least in this case, we know it was an address request for that site. Same with like if someone, I guess, wants to just complain about an agency we referred them to, and we say like, can I get you over to like consumer protection or to Better Business Bureau? And they're saying, no, I just want to tell you guys that I went to that food pantry. It was terrible. Like you could log that way. Explanation of agency or site. The example I always use with that is people just calling to say like, hey, what's 211? I just saw this number somewhere. And then you explain it and they're like, okay. And you're like, you help with anything? Like, no, I just wanted to know what's up with it. Hours request, same as address request. I always go to this one food pantry in my neighborhood. I just don't remember what time they open. Monetary donation. This is where someone wants to donate money to a particular agency. There's really no way to record that other than this. A thank you call. I don't really necessarily know. Like, hey, thanks for referring me to that agency, I guess. Phone number request, again, same thing as above. Printed material, promotional items. Hey, I saw that the YMCA is giving away these cool T-shirts. How do I get one? You feel like, oh, well, probably call the YMCA, but don't know how to record it. But again, rather than reference information or guidance and problem solving, you can actually say, here's where this will link it to that actual agency or site. We used this specifically around tax season this year. Volunteer information. This is probably going to be more relevant in non-Cuyahoga, non-Medina counties where there isn't a volunteer clearinghouse to refer people to, but it could be useful here if they don't want to go to Greater Cleveland Volunteers. They just want to say, no, I really just want to contact, St. Malachi to volunteer there. I don't want to talk to Greater Cleveland Volunteers. So you gave them the number, and that was for volunteer information. And then the other one that we've added, I think pretty recently, is this update one. And so this is when an agency calls you or a person calls you to say, hey, this food pantry's closed today. Or, I heard that program's gone. And so this way you can go to it and record that reason that, you did a transmittal without having to use a reason for contact. Because really, the reason for contact, you want to use as little as possible because it tells us the least about the conversation that you had with someone and kind of what you ended up doing or talking them through. And I know there's going to be plenty of times when you need the reason for contact, but if you can link it to either a site, and so parent agency, so like those that I was just looking at, these save reasons, this is the top of your like a service profile. That would be if someone were talking to me specifically about, this job prep program at El Barrio, and I had a reason for that. If they're just talking about the Centers for Families and Children, I can do my parent agency in that case because I give the main administrative number or something and save reasons at that level. Otherwise, you do have your reason for contact, a lot of which, you use with no data calls, such as the auto callback, or like when you just get a voicemail or the no call on the line. But the two big ones, like we're trying to just avoid as much as possible, but again, you're going to have them, is that guidance, problem solving assistance, and reference information. And these two, I would say generally, this is when you can't even assess like you're having a conversation, but the person will not allow you to assess them at all or even really express like a specific need, although we do have caller unable to define need, but like you've given some kind of information. We're trying to come up with examples for like reference information. One of the ones
I got another question for you.
Yeah. Totally.
Can you go to the problem gambling addiction helpline and get to that? I always meant to send something because sometimes it doesn't make sense. Like say you have somebody who calls and you see here it just has problem solving. It might just be someone called and they had the wrong number but they didn't hang up on me. I just explained that, hey, this is what we are, and they were like, oh, I thought I wanted the casino or the buffet.
Right.
And then I always have to go guidance problem solving because I really don't have anything else because I haven't really gotten any data because, they have the wrong number.
So that's just essentially next time we talk to the state, I'll just have to get everything in there. Everything in here has to be vetted and approved by them. So this is kind of what they'd approved, but I'm sure once I explain that problem, I'll just present them with all our other ones and say, hey,
so in the meantime, keep using the guidance problem.
Yeah, in the meantime, whatever you're doing there. Yeah, I think that's fine. But that is a good point that we do need to get that to line up. it's good. We have meetings with them this month because that contract renews July 1. So we're in the first month of this year's contract. So they want to meet with us about reporting and training and all of that good stuff. So I will be talking to them in just a couple of weeks. So I will bring that up. Let me make a note to make sure we get those approved so we can add them for you. Henry. Okay. But yeah, so then in general, like reasons for contact, this is, yeah, when you can't even narrow a conversation down to like an agency or a site. It's not a referral, it's not an unmet need, you haven't talked about a specific agency or a specific program, you're just, either it's a no data call with one of these, very specific ones, or you provided them like some kind of common knowledge or something that, again, there was no assessment, it didn't lead, like, is today Easter or something, and you said, yes, like today is Easter, when it's Easter Sunday, that reference information. But is everyone comfortable with the reasons and the unmet needs and the met needs? I think here I just say, don't you all get wacky with the guidance problem solving assistance and reference information. And again, this is partially, I feel bad that we left out the site and program reasons the last time we did this training, because that is not helpful. Does that all make sense? Does anyone have like general questions about refer or anything that, like, when you knew you were getting, or like we were doing refer training, that you were hoping or expecting to be covered that I totally did not cover?
Can I re-listen to this?
Yeah, I recorded. I just got to pick which session. Yeah, we recorded 3 of them. So I think I'm going to use the one. So it may not be this one. I'd probably use there was a different one I think I just answered some more questions and stuff. But yes, there will be a recorded version of this made available. You can see the beginning and everything. People are good. Disaster calls, no data calls. The only thing I was really saying about no data calls is definitely when you're doing a no data call, sometimes people are really meticulous and still record like not applicable, did not ask, and all that on here. Like, you don't need to do that. Oh, the other thing I'll say about unmet needs that I didn't mention to any group, but I see sometimes people, is it with unmet needs usually? Sometimes when people have like when it's not an other, but like it is just like a food pantry or something, they'll still fill out the notes here. You don't have to do that, and we don't use them for anything unless it was for an other, and then those kind of get called together to add to the list of things that we don't have indexed. But if it's not other, like those notes aren't looked at, so you don't have to record anything. So if you've been recording something it's cool, but just so you know, we don't look at them. I'm not telling you not to do it. You don't have to do it. Yeah, so if there's no other questions, I think we're good. We've 10 minutes of people questions. If not, I can let you all go, and everything's cool. Everything cool?
Okay.
Sounded like stuff's cool, I guess. Okay, well, thank you, everybody. Oh.
When
cool.
will you have where I can listen to it again? How soon will that be? Because I think I missed the first 10 minutes of your talk. That's why.
Right. No, I know. We're going to put it up on YouTube. As early as next week. I already converted them all. I just got to go through and pick one. Again, yeah. Okay. We'll send a link out, and there may also be. I'm not sure. I took roll at all these. I'm not sure how many people ended up missing the session. So if it was a bunch of people, which I don't think it was in this case, but there may be a makeup session too. But again, there'll definitely be a recorded one on YouTube that we can get you a link for next week sometime.
Okay, bye.
Cool. Bye. Thank you, everybody.
Bye.
Good night.
Thank you.